It's incredibly gratifying to go with patients throughout the process of a journey through cancer, from the very beginning when they come to see me because they've got, let's say, a spot in their lungs. So to be able to use some technology and procedures that we've been involved in developing and interacting with and investigating, apply that technology to help a patient, and then sending that patient on to the next phase of their care is incredibly rewarding, and I think some of the things that we really do well here. So the care team at Siteman Cancer Center is really a village, and it takes a village to really take care of patients as well as possible and give them what they deserve. One of the challenges that we see with patients who are being treated at places that don't have this type of coordination are they're moving from one place to another. There might be a delay. There might be confusion on patients' behalf as well, which is really one of the things you want to try to avoid the most, because many times patients are getting this diagnosis of cancer and they want to know what's next in store for them. And so if there are periods of time where they're not aware of what that next step is, that can be really terrifying to them and their families. So one of the things that's really important here, and it extends beyond physicians, but is the entire healthcare team, nurses, physician assistants, secretaries, administrative assistants, they all support the team of physicians that are face-to-face with patients, and they allow us to really offer seamless care so that patients know every step of the way what's coming next, and hopefully that makes them feel more comfortable with an already difficult process. Treatment for cancer has really changed. It's not a one-size-fits-all type of therapy anymore. There's new treatments that are available, and often those are tailored to a patient's individual needs. But because there are different ways to treat patients, our job is really to guide them through the process. We want to have patients involved in the decisions that affect their healthcare, so we want to make sure that they're completely informed about what's available. We're not here to tell you what to do, we're just here to guide you. My job is to make sure you have all the information available that I have access to that allows you to feel comfortable with the decision you're making. The interaction between doing research and patient care is a journey just like everything else. So one of the things that I think is important for patients to understand is that while you might see us use some new technology to take care of you, to diagnose cancer or to treat cancer, we have a long-lasting relationship with that technology. So it's not new to us, because in most instances, we've been involved in the development of the technology or involved in a clinical trial that used that type of technology, even though it might be something that's new to the public. There have been a lot of technological advancements that we deal with in terms of diagnosing cancer as well as treating cancer. The area that I'm involved with primarily is in the diagnosis of cancer and then treating any symptoms that might be related to someone's cancer. From the diagnostic end, there have been a lot of advancements right now in the ways that we diagnose cancers, particularly at an earlier stage. One of the nice things about our experience here is that because there are more than one way to diagnose lung cancer, and we have experience in all of them, we get to choose with the patient the process, the procedures that will really work best for them individually. In that way, we're choosing the procedure that's best suited for them and not for us. The thing that got me most interested in pursuing oncology is a draw toward taking a patient who has some abnormalities, something they're concerned about, and taking that journey with the patient. And we're fortunate sometimes that journey doesn't lead to a diagnosis of cancer, but in cases where it does, making connections for those patients to other healthcare members of our multidisciplinary team and knowing that those patients are going to be well taken care of, that's incredibly rewarding. And patients who are being treated for cancer and going through that journey, they're the most vulnerable population I think that we have in many instances. So being able to assist them is something that's incredibly satisfying.